Have you ever woken up at exactly 3 a.m., wide awake, with your mind racing, only to struggle getting back to sleep? If this happens to you regularly, you're not alone. And it's not just because you've had a bad day. In fact, it might be telling you something important about your health. In today's video, we're diving into why so many older adults find themselves wide-eyed at 3 a.m. and what this could really mean for your overall health and well-being. Stick around to learn not only what's going on with your sleep, but also how to finally get the rest you deserve. So why does it seem like 3 a.m. is the magic time for wake-ups, and what can you do about it? Let's break it down. Before we dive in, if you're new to our channel, don't forget to hit that like button, subscribe, and press the bell notification so you never miss out on the latest tips and advice for living a healthier, happier life. Now let's jump into today's topic, the science of aging and sleep. As we age, our bodies go through a variety of changes, and our sleep patterns are no exception. One of the most noticeable shifts is a change in the quality and duration of sleep. In younger years, we experience deep restorative sleep cycles, but as we get older, these cycles tend to become lighter and more fragmented. The result is that older adults often spend more time in the lighter stages of sleep, which can make it easier to wake up during the night, especially in the early morning hours. A key factor in this shift is the circadian rhythm, which acts as your body's internal clock. The circadian rhythm regulates when you feel awake and when you feel sleepy, typically aligning with the natural light-dark cycle. As we age, this rhythm can begin to shift, meaning we may feel sleepier earlier in the evening, but also wake up earlier in the morning. This is why many older adults find themselves waking up before sunrise and sometimes struggling to fall back asleep. In addition to changes in the circadian rhythm, melatonin, the hormone responsible for regulating sleep, starts to decrease as we get older. Melatonin helps signal to your body that it's time to sleep. Lower levels of melatonin can lead to more restless nights and can make it harder for older adults to fall asleep or stay asleep throughout the night. The reduction in melatonin production may be why 3 a.m. is such a common wake-up time. By this point, your body's natural sleep signals have weakened. Lastly, the sleep architecture itself undergoes changes. The deep restorative stages of sleep, known as slow-wave sleep, become shorter and less frequent. This means that older adults may spend more time in lighter stages of sleep, where they are more likely to wake up, even if for just a few minutes. This shift in sleep patterns isn't necessarily a cause for concern, but it can disrupt the ability to get a full, uninterrupted night of rest. Understanding these changes can help us address and manage sleep challenges as we age. Why 3 a.m.? So, why is 3 a.m. the time when so many older adults seem to wake up? The answer lies in the structure of our sleep cycles. Throughout the night, we move through several stages of sleep, transitioning between light sleep, deep sleep, and REM, rapid eye movement, sleep. These cycles repeat every 90 minutes, with the deeper stages occurring earlier in the night. By the time 3 a.m. rolls around, most people are either in a lighter phase of sleep or are transitioning between sleep cycles, making it easier to wake up. For older adults, these transitions tend to happen more frequently, and the body's ability to stay in deep restorative sleep decreases. Around 3 a.m., your body is naturally lighter in sleep, which means it's easier to be disturbed by external factors like noise, discomfort, or even a slight change in body position. The deeper sleep cycles, which provide more rest and rejuvenation, tend to be shorter in older adults, further explaining why waking up at this time is so common. Another reason 3 a.m. can be a frequent wake-up time is due to the natural fluctuation of body temperature. The body's core temperature naturally decreases during the night, helping to prepare for restful sleep. However, by early morning, this drop can make some people feel more restless, especially if their sleeping environment isn't ideal or if they're experiencing hot flashes or cold sweats. These discomforts can disrupt sleep, leading to that 3 a.m. wake-up, which can feel like a physical need to adjust or get comfortable. Finally, stress and anxiety can also play a role in waking up at this time. Older adults may experience heightened stress levels, whether from health concerns, family matters, or simply worrying about the future. As the body's cortisol, stress hormone, levels rise, even during the night it can cause disturbances in the sleep cycle, leading to early awakenings. The brain is still processing these stresses during the night, And by 3 a.m., when the body is in a lighter phase of sleep, it becomes easier for these thoughts and worries to stir you awake. Health implications of waking up at 3 a.m. Waking up at 3 a.m. regularly might not just be a nuisance. It can also signal underlying health concerns. Studies suggest that disrupted sleep can impact everything from cognitive function to immune health. 1. Cognitive function. Waking up at 3 a.m. regularly can have a significant impact on your cognitive function. Our brains rely on sleep to rest, repair, and rejuvenate. Deep sleep, in particular, plays a crucial role in memory consolidation and cognitive performance. When sleep is disrupted, especially when it happens repeatedly, the brain doesn't get the necessary time to process and store information effectively. This can lead to difficulties with concentration, memory, and learning. Lack of quality sleep can affect the brain's ability to focus and complete complex tasks. For older adults, this may manifest as forgetfulness or difficulty recalling information. Over time, chronic sleep disturbances can contribute to more severe cognitive issues, including memory problems and even conditions like dementia or Alzheimer's disease. Studies have shown that sleep deprivation accelerates the buildup of amyloid plaques in the brain, which are linked to Alzheimer's, suggesting that disrupted sleep may worsen cognitive decline. In addition to memory problems, sleep deprivation can also negatively impact your mood and emotional regulation. Without enough restorative sleep, the brain becomes less able to manage emotions, leading to irritability, anxiety, or even depression. This can be especially troubling for older adults, as these emotional challenges can make it harder to cope with daily life and can significantly reduce quality of life. The impact on cognitive function extends beyond just feeling forgetful. It can impair decision-making skills, problem-solving abilities, and even reduce the effectiveness of the brain's immune responses. So consistently waking up at 3 a.m. can set off a chain reaction that affects not just your memory, but your overall brain health and mental sharpness. 2. Heart health. The connection between the sleep and heart health is well established, and waking up at 3 a.m. regularly can have serious consequences for your cardiovascular system. During deep sleep, the body is able to repair and regenerate tissues, including the heart and blood vessels. When sleep is interrupted or incomplete, the body struggles to perform these functions effectively, which can put added strain on the heart over time. One of the most concerning issues is the effect on blood pressure. When sleep is disrupted, particularly during the night, the body's blood pressure can remain elevated even during the hours when it should naturally lower. This constant strain on the heart can increase the risk of hypertension, high blood pressure, which is a major contributor to heart disease, stroke, and other cardiovascular problems. Studies have shown that people who experience fragmented sleep are at a greater risk of developing these conditions. In addition to hypertension, chronic sleep disturbances can also affect the balance of stress hormones, such as cortisol. When the body experiences stress during the night, whether it's due to waking up at 3 a.m. or other factors, it triggers the release of cortisol, which can elevate heart rate and blood pressure. Over time, this can lead to a heightened risk of heart attacks or other cardiovascular events, especially in older adults who are already more vulnerable to heart disease. Furthermore, poor sleep can lead to an increased risk of inflammation throughout the body. Chronic inflammation has been linked to the development of cardiovascular diseases, including heart disease and atherosclerosis, hardening of the arteries. So while waking up at 3 a.m. may seem like a minor inconvenience, its long-term impact on heart health can be significant and should not be overlooked. 3. Mental health. Waking up at 3 a.m., especially if it's a regular occurrence, can severely affect mental health, contributing to issues such as anxiety and depression. The lack of restorative sleep means that the brain doesn't have the opportunity to process emotions or manage stress effectively. As a result, individuals may become more prone to feeling overwhelmed, anxious, or sad during the day. This can make it harder to cope with everyday challenges, leading to a negative cycle of poor sleep and worsening mental health. For older adults, the impact of sleep disturbances on mental health can be even more pronounced. As people age, they may already face challenges related to loneliness, health problems, or life transitions. When sleep is consistently disrupted, these feelings can become more intense, leading to heightened anxiety, stress, and even depression. Lack of sleep makes it difficult to regulate mood, leading to irritability and a sense of hopelessness or despair, which can further exacerbate mental health issues. Chronic sleep deprivation has also been linked to a decrease in the brain's ability to handle stress. The hippocampus, which is responsible for regulating emotions and stress responses, doesn't function as effectively when sleep is disturbed. This means that over time, the brain becomes less resilient to emotional pressures. For older adults, this can translate into feelings of isolation, frustration, and a decreased sense of well-being, which can have serious consequences for overall mental health. Finally, sleep disturbances can interfere with social engagement and relationships. When an individual is waking up at 3 a.m. and feeling fatigued throughout the day, they may not have the energy or motivation to engage with others. This isolation can further contribute to feelings of sadness or depression, creating a vicious cycle. Addressing sleep issues is therefore critical, not just for physical health, but for maintaining positive mental and emotional well-being as we age. What you can do. If you're waking up at 3 a.m. consistently, there are several things you can do to improve your sleep quality. 1. Establish a consistent sleep schedule. One of the most effective ways to combat waking up at 3 a.m. is by establishing a consistent sleep schedule. Going to bed and waking up at the same time every day, even on weekends, helps regulate your body's internal clock or circadian rhythm. Your circadian rhythm thrives on routine, and when it's disrupted, it can make it much harder to fall asleep or stay asleep. By committing to a regular sleep schedule, you help your body sync with its natural sleep-wake cycle, which promotes more restful and uninterrupted sleep. This consistency signals to your body when it's time to wind down and when it's time to be awake, which can help prevent those middle-of-the-night wake-ups. Over time, your body will begin to anticipate the set times for sleep and wakefulness, making it easier to fall asleep and stay asleep. For older adults, this routine can be especially important since aging tends to disrupt the natural sleep-wake rhythm. By keeping a regular schedule, your body's production of melatonin, the hormone that signals it's time to sleep, becomes more predictable, reducing the chances of waking up at odd hours. Additionally, when you consistently get enough sleep, you allow your body to reach the deeper stages of sleep, which are the most restorative. This can help reduce the lighter, fragmented sleep that often leads to waking up at 3 a.m. By establishing a set bedtime and wake-up time, you give your body the best chance to complete full, uninterrupted sleep cycles, leading to more energy during the day and a reduced likelihood of waking up prematurely. To make this easier, start by setting a bedtime and wake-up time that you can realistically stick to every day. Try to gradually adjust your schedule if necessary. Shifting your bedtime or wake-up time by 15 minutes every few days can make the transition smoother. Eventually, you'll train your body to fall asleep and wake up naturally at those times, reducing sleep disruptions and improving the overall quality of your rest. 2. Limit stimulants. Before bed, the things you consume before bedtime can play a major role in whether or not you wake up at 3 a.m. Certain substances, such as caffeine, nicotine, and alcohol, can significantly disrupt your sleep cycle, leading to restless nights and early awakenings. Caffeine, for example, is a well-known stimulant that can stay in your system for several hours after consumption. Even if you consume coffee or tea in the afternoon, it can interfere with your ability to fall asleep at night and lead to a fragmented sleep cycle. Nicotine, found in cigarettes and other tobacco products, is another stimulant that can affect your sleep. It may initially make you feel relaxed, but as the effects wear off, it can cause you to wake up in the middle of the night, particularly when you're already in a lighter stage of sleep. If you're trying to quit smoking, this can be especially challenging, as the withdrawal symptoms can disrupt your sleep patterns and cause frequent wake-ups, including around 3 a.m. Reducing or eliminating nicotine consumption, especially in the hours leading up to bedtime, can help improve sleep quality. Alcohol is another common culprit when it comes to disrupted sleep. While it may help you fall asleep faster, alcohol interferes with the deeper stages of sleep, including REM sleep. This can lead to fragmented sleep, and by 3 a.m., your body may have entered a lighter sleep phase, causing you to wake up. Alcohol also increases the likelihood of dehydration, which can cause discomfort and further disrupt sleep. To improve your sleep quality, Try to avoid alcohol at least 3 to 4 hours before bedtime to give your body the chance to process it fully. In addition to these substances, it's also important to avoid heavy meals or spicy foods right before bed. Digesting food takes energy, and large meals or foods that cause discomfort can lead to indigestion or acid reflux, which can disturb your sleep. If you're prone to waking up at 3 a.m., consider making dinner your lightest meal of the day and aim to finish eating at least 2 to 3 hours before going to sleep. 3. Create a relaxing bedtime routine. A relaxing bedtime routine is essential for signaling to your body that it's time to wind down and prepare for rest. Engaging in calming activities before bed helps lower stress levels and promotes relaxation, making it easier to fall asleep and stay asleep throughout the night. For older adults, establishing a consistent wind-down routine can be particularly beneficial as it helps calm the mind and ease the body into sleep, reducing the chances of waking up at 3 a.m. One effective relaxation technique is to engage in mindfulness or meditation before bed. Deep breathing exercises, guided imagery, or gentle stretches can help relax your muscles and calm your mind, reducing any feelings of tension or anxiety. You might also try progressive muscle relaxation, where you slowly tense and relax each muscle group in your body, starting from your toes and moving up to your head. This method can help release physical tension and promote a deeper state of relaxation. Another helpful activity is reading a book, listening to soft music, or engaging in light, calming hobbies such as knitting or drawing. It's important to avoid stimulating activities such as watching intense movies or working on projects that require high levels of concentration, as these can make it more difficult to unwind. The goal of your bedtime routine is to create a peaceful, soothing environment that signals to your body it's time to sleep, which in turn makes it easier to fall asleep and stay asleep without waking up in the middle of the night. In addition to these activities, consider creating a relaxing atmosphere in your bedroom. Dim the lights, use aromatherapy with calming scents like lavender, and ensure your bedroom is at a comfortable temperature. Creating an environment that's conducive to sleep can make a significant difference in the quality of your rest and reduce the likelihood of waking up in the early morning hours. The combination of a calming routine and an ideal sleep environment can help you get a full night's rest and avoid waking up at 3 a.m. 4. Monitor sleep environment. Your sleep environment plays a crucial role in the quality of your sleep, and improving it can make a significant difference in whether you wake up at 3 a.m. Start by evaluating the comfort of your mattress and pillows. As we age, our bodies become more sensitive to discomfort, so it's important to ensure that your mattress provides the right support for your spine and joints. If your mattress is old or uncomfortable, consider upgrading to one that better suits your needs, whether it's a memory foam mattress or one that offers targeted support for pressure points. In addition to your mattress, check the temperature of your bedroom. A room that's too hot or too cold can disrupt sleep and cause discomfort, leading to frequent wake-ups throughout the night. The ideal temperature for sleep is typically between 60 to 67 degrees Fahrenheit, 15 to 20 degrees Celsius. You can adjust the temperature with fans, air conditioning, or extra blankets to ensure you're comfortable. Keep in mind that temperature fluctuations during the night can also trigger restlessness, so try to maintain a consistent and comfortable environment. Another important aspect of your sleep environment is the level of noise and light in the room. Excessive noise, whether it's from traffic, family members, or other sources, can disturb your sleep and make it difficult to stay asleep. Consider using earplugs or a white noise machine to block out unwanted sounds. Similarly, exposure to light can signal to your brain that it's time to wake up. To promote better sleep, make sure your bedroom is as dark as possible. You can use blackout curtains or an eye mask to block out any light, especially if you live in an area with street lights or early morning sunlight. Lastly, it's important to eliminate distractions in the bedroom that could interfere with sleep. This includes electronic devices such as smartphones, tablets, and TVs. The blue light emitted by screens can interfere with the production of melatonin and make it harder to fall asleep. Make a habit of turning off electronics at least an hour before bed to give your body the best chance of falling into a deep and restful sleep. By optimizing your sleep environment, you can significantly reduce the chances of waking up at 3 a.m. and enjoy more peaceful, uninterrupted nights of rest. When to seek help. If you've tried adjusting your sleep routine environment, and habits, and you're still waking up at 3 a.m. regularly, it may be time to seek help. Chronic sleep disturbances could be a sign of an underlying sleep disorder or health issue that requires professional attention. Conditions like sleep apnea, restless leg syndrome, or insomnia are common in older adults and can significantly disrupt sleep, leading to frequent awakenings during the night. Sleep apnea, for example, occurs when your breathing stops and starts throughout the night. This can cause you to wake up multiple times, often without realizing it, and leave you feeling tired and unrested. If you snore loudly or experience gasping for air during sleep, it's important to talk to a healthcare provider. Sleep apnea can be treated with lifestyle changes, CPAP therapy, or other interventions, but it requires a diagnosis from a doctor to determine the best treatment approach. Restless leg syndrome, RLS, is another condition that can disrupt sleep, causing uncomfortable sensations in the legs, often leading to a strong urge to move them. This sensation can make it difficult to fall asleep or stay asleep, and it's often worse at night. If you experience these symptoms, it's important to discuss them with your doctor, who can offer treatment options to help ease the discomfort and improve your sleep quality. If your sleep disruptions are causing significant distress, affecting your mental health, or impacting your daily functioning, don't hesitate to reach out for help. A healthcare provider can perform an assessment, recommend a sleep study if necessary, and work with you to create a plan to address any underlying health issues. By seeking professional help, you can get the proper diagnosis and support needed to improve your sleep and overall well-being. Thanks for watching. If you found this video helpful, make sure to like, subscribe, and hit the bell icon for more tips on improving your health and sleep. Remember, better sleep leads to a healthier, more vibrant life. Take care, and we'll see you in the next video.